Would you like to close, Senator McGuire? I think you have.
Thank you.
Hill.
Aye.
Hill, aye. Bates. Berryhill. Block. Block, aye. Galgiani. Hernandez. Hernandez, aye. Jackson. Mendoza. Wachowski. Wachowski, aye.
That bill has 4 votes. We'll hold it open until for the absent members. Thank you, Senator McGuire. Senator Burrell, thank you for your patience. And I noticed that this has support all the way around from everyone, it looks like.
Except the thing about thank you for your patience.
Ah,
Well, thank you, Mr. Chair and members. SB 1209. This is easy. It's a consumer protection bill that closes a loophole in our current laws. Currently, the Contractor State License Board requires contractors to publicly disclose any citation they have received within the past 5 years. The problem is if a contractor obtains a new license, the citation does not follow them. The Contractor's State License Board does not extend the 5-year citation disclosure to any newly issued licenses. SB 1209 simply states that the responsible contractor referred to as the qualifier will have to disclose the citation on any other license they obtain. This bill has been narrowly tailored to apply only to the qualifier. So those bad guys or bad gals make the market much more difficult for honest contractors. 1209 upholds the original intent of existing complaint disclosure laws. So in that sense, nothing's changed. Furthermore, this bill will provide consumer protections by ensuring citations are properly disclosed to the public. I would like to introduce to you Laura Zuniga, who is here on behalf of the Contractor State License Board.
good evening.
Move the bill.
We have a motion for Senator Block to move the bill. Thank you, Senator Block. We have a motion. Well, it's too late for discussion now. Motion from Senator Block. Would you like to close?
I'd like to ask for your aye vote, please.
Very
Thank
good.
you.
Thank you very much. This due pass to Senate Appropriations Committee. Please call the roll.
Hill.
Aye.
Hill, aye. Bates. Berryhill. Block. Block, aye. Galgiani. Hernandez. Hernandez, aye. Jackson. Mendoza. Wachowski. Wachowski, aye.
Members, thank you.
That has 4 votes. We'll hold the roll open for the absent members. Thank you, Senator Morrell. Appreciate it. Now we'll move to Senator Wachowski. Item number 11, Senate Bill 1400. And if you could do Senate Bill 1470 at the same time, maybe we'll have one grand presentation.
Yeah, this is a modest proposition that might do more to prevent exposure and access to tobacco products to minors by reducing the pervasive presence in retail stores. As the committee report pointed out, California, while it enjoys a lower smoking rate than other states, has 40,000 Californians that die each year. And despite the penalties of selling tobacco to minors, 90% of smokers today say they began smoking before they were 18 or 21, if that ever gets signed. So included in the committee report was a Stanford study conducted in California that found that compared to other convenience stores in the same community, convenience stores popular with adolescents displayed more than 3 times as many cigarette marketing materials in the store windows and contained almost 3 times more marketing material inside, and 2 times as much as the shelf life space for Marlboro, Camel, and Newport. And these are the 3 brands that account for 80% of what the kids smoke. So SB 1400 prevents kids from picking up a lifetime habit, or hopefully prevents them from picking up a lifetime habit of tobacco use by limiting its sales to locations where kids under 18 are not allowed to go. Adults who would like to use tobacco products can still continue to do so by making their purchases at the tobacco stores. It restricts marketing and sales to the very establishments designed to just for adult smokers. 1470 is meant to be the companion bill to 1400, and the fate of the special session tobacco bills is currently unknown, and I'm moving SB 1470 in the event that there is a need to respond to that outcome, and I urge your aye vote on that definition.
Thank you, Senator Wachowski. So we will ask for those in support of SB 1400 and SB 1470, or either one? Either one, very good, thank you.
There may be some.
Good afternoon. Good afternoon, members. Betsy Armstrong on behalf of the county health executives in support.
Very good, thank you. Others in support? Is there anyone here in opposition? We have a motion to move the bill. I talked to Senator Wajkowski when I looked at this. It just struck me that we were going to be, there are those in our society who don't live next to a actual tobacco store, and that it could be a real problem. When you have 33,000 retailers today, and that would drop to about 10,000, and, the addiction to nicotine, if you've got it, you've got it, and it's tougher than that heroin in many cases. But in thinking about it and actually talking to Senator Block, the conclusion came that the market will probably work itself out and find those locations that maybe where those who are severely addicted, and in many cases in lower socioeconomic areas of the community, that they will be able to provide for that habit, unfortunately, until they can find the will and the way to get past it. So we do have a motion from Senator Hernandez. So very good.
I urge and I vote.
Thank you very much. This is on SB 1400, item number 11. Please call the roll.
Motion is due pass the Senate Appropriations. Hill.
Aye.
Hill, aye. Bates. Berryhill. Block. Block, aye. Galgiani. Hernandez. Hernandez, aye. Jackson. Mendoza. Wachowski.
Aye.
Wachowski, aye.
4-0. We have a motion on SB 14-7 from Senator Hernandez. Please call the roll.
Motion is due pass to Senate Appropriations. Hill.
Aye.
Hill, aye. Bates. Berryhill. Block. Block, aye. Galgiani. Hernandez. Hernandez, aye. Jackson. Mendoza. Wachowski.
Aye.
Wachowski, aye.
4-0. We could lift the call. We have two bills left. We will have 2 Hill bills left. If that works all right, let me present the 2 bills.
4, this is 3.
So
Okay, we're in item number 3, SB 994 Hill Antimicrobial Stewardship Policy. Mr. Chair, please proceed.
Thank you very much, Mr. Chair. I'd like to first accept the amendments listed in paragraphs 5, 6, and 7 on page 8 of the analysis. There is a problem so serious that it threatens the achievements of modern medicine. That's what the World Health Organization said about antibiotic resistance, which kills at least 23,000 Americans each year, and by 2050, more people worldwide will die from antibiotic-resistant infections than from cancer. Take Carlos Don, a Southern California 12-year-old who was killed by a deadly antibiotic-resistant infection. Carlos was an active and healthy 6th grader and a naturally gifted athlete. Nearing his 13th birthday, he came down with what was initially thought to be pneumonia and was given antibiotics. His parents were told that once they kicked in, Carlos would start feeling better, but he never did. He was later hospitalized and diagnosed with MRSA. He died 2 weeks later because antibiotics couldn't kill the resistant superbug. To help curb the rise of these deadly infections, I've authored 3 successful pieces of legislation to regulate antibiotic use in livestock and to require antibiotic stewardship in hospitals and nursing homes. These are critical interventions, but the majority of antibiotics, upwards of 80%, are prescribed in non-hospital settings by primary care doctors, nurse practitioners, dentists, and other providers. According to the CDC, up to 50% of the prescriptions are not needed, driving the development of antibiotic resistance. A key solution to the problem is to reduce this inappropriate prescribing through antibiotic stewardship, which promotes better prescribing through educational interventions. That's why the President's Antibiotic Resistance Action Plan calls for a 50% reduction in antibiotic use in outpatient settings and calls for antibiotic stewardship in those settings. SB 994 simply requires that outpatient health facilities have an antibiotic stewardship policy in place. just as hospitals and nursing homes are already required to do. The bill will ensure oversight in two ways. For clinics licensed by the Department of Public Health, the stewardship requirement will be verified through a normal licensing process. For outpatient facilities not licensed by the state, such as a doctor's office, the requirements will be verified through the regulatory boards. To comply with the bill, the practitioners can simply adopt the CDC guidelines once they are published or create their own policy as long as it's consistent with evidence-based practices, of which there are many. The Medical Association has expressed concerns with the bill, and I have offered to work with them as well as other medical professions that might also have concerns. You will hear from the CMA that the requirement is vague and will be burdensome to implement. I recognize that doctors have a difficult job, but the risk of inaction far outweighs any implementation burden. Antibiotics are a shared resource, and unlike other drugs, the more we use them, the less effective they become. I built flexibility into the bill so each practitioner can implement a stewardship policy that works best in his or her practice. For example, to comply with the bill, all a practitioner has to do is put up posters stating that his or her commitment to appropriate prescribing. And that doesn't sound very overly burdensome to me. Doing that, just putting the posters up, has shown to reduce inappropriate prescribing by 20%. As another example, a policy could simply be that prescribers need to justify in a patient's chart the reason for prescribing an antibiotic. The act of justifying the prescription to oneself has been shown to reduce inappropriate prescribing by 77%. If we can make the language more clear than it already is, I am certainly open to suggestions. CMA also argues that California is ahead of the curve when it comes to the issue of excessive prescribing. It's true that per person fewer antibiotics are prescribed in California than in many other states, but the rate of excessive prescribing is not lower in California. Up to 50% of the antibiotics prescribed in outpatient settings are unnecessary. Lastly, CMA argues that the bill will create a significant workload for the regulatory boards and might put a practitioner's license in jeopardy. With the amendments I am accepting today, the stewardship requirements will no longer be tied to a practitioner's license. And to further address implementation concerns, should the committee decide to pass the bill, I am open to working with stakeholders on amendments in the Senate Health Committee to phase the bill in over time. In closing, the solution proposed in SB 994 is not a silver bullet for the issue of antibiotic resistance. Other steps must be taken, such as developing new antibiotic drugs. But there is consensus that one of the most important actions we can take today is to reduce inappropriate prescribing, and that's what the bill seeks to do. Current California law already requires antibiotic stewardship in hospitals and nursing homes. This just extends it to outpatient settings where 80% of the prescribing occurs. It's supported by the California Hospital Association, the Society of Infectious Disease Pharmacists, 25 health groups, including the CDC, American Academy of Pediatrics, and the American Academy of Physician Assistants, have signed a joint statement supporting antibiotic stewardship. They are not in support of this legislation, those 25 health groups, the Society of Infectious Disease and the California Hospital Association are. I respectfully ask for an aye vote, members.
Thank you. Anyone in support?
Good afternoon. My name is Lisa McGifford. I'm with Consumers Union's Safe Patient Project, and we want to register our support for Senate Bill 994. We really have to get serious about antibiotic resistance, and the first step is to get rid of inappropriate use of antibiotics. And that this bill is the first step toward doing that in the outpatient setting. This is where a lot of inappropriate prescribing is happening, and we really have to start tackling this, or people are going to start dying from very minor procedures in the future if we don't really get a handle on this. So please support this bill. Thank you.
Thank you. Anyone else in support?
Yes, my name is Carol Moss, and I also represent Consumer Patient Project and Niles Project. I, too, had a son that died of antibiotic resistance. We not only failed him when he went into the top children's hospital in Orange County for an annual series of tests where he contracted MRSA, but when it was time for treatment, when he had a fever and he was wheezing and he had a hard time breathing, a doctor took a test. They said he had strep throat and handed me a prescription for strep throat. The test had come out negative. I spent the last 5 hours of my son's life in a Rite Aid waiting for a prescription that was inappropriate and didn't work. I ask you and urge you to be in support of this and support Senator Hill.
Thank you. Anyone else in support? Opposition? Please proceed.
Thanks. Good evening, Mr. Chair and members. Megan Allred on behalf of the California Dental Association. CDA remains formally opposed to Senate Bill 994 as currently written, but we're really encouraged by the discussions we've had with the author's office and the consideration they've paid to our concerns surrounding the lack of data specific to antibiotic prescriptions in dentistry. We're supportive of the author's intent to combat antibiotic resistance, and our national counterpart, the American Dental Association, has asked for the inclusion of a dentist representative on the White House task force, as the CDC has noted a minimal amount of prescribing data for outpatient dental offices. At this point, there's been no movement at the federal level to appoint a dental representative or include dental in their data gathering. Without anything other than raw numbers of antibiotic prescriptions written by dentists and no identification of the instances that might be inappropriate, it seems preemptive to create a plan or best practices that would detail a way to prescribe more cautiously or correctly. We look forward to continuing conversations with the author on how dentistry fits into this picture and would urge Senator Hill to encourage the inclusion of dental at the federal level so that we can begin to identify any problems within our industry's antibiotic prescribing. Until then, however, we have no place from which to start formulating solutions.
Thank you. Anyone else in opposition?
Good afternoon, Alicia Sanchez with the California Medical Association, and we too appreciate the conversations that we've been having with the Senator's office. And also, I should thank you for the very thorough review of our opposition letter and our concerns in your testimony. We are reviewing the amendments to determine, how that would impact our official position. A couple points just to respond to the Senator's testimony in that the unprofessional conduct is still tied to the license. So that we will be looking to see how we believe that will impact physicians. That being said, we still do believe that there is not consensus actually on a mandate. Now, there has been, and physicians have been involved proactively on the issue of antibiotic stewardship as well as reducing inappropriate prescribing for quite a long time, including here in California. However, the conversation as it relates to outpatient settings is one that is fairly new in the context of the larger conversation. Most of the work has been done really in systems, so hospital systems. And so there are outstanding questions about how this ultimately applies in an outpatient setting. And that is foundational in our concern. And we continue to oppose today. Thank you.
Thank you.
Tim Shannon, representing the California Orthopedic Association. We don't have an official opposed position on this bill. We share some of the concerns that have been raised. Surgeons are in kind of a different position in that the only time they prescribe antibiotics is prior to surgery and after surgery. And when they do, they follow CDC guidelines. We've had a conversation with Mr. Welch of Senator Hill's staff. I met with him last week. And we would like to encourage the author to consider exempting surgical specialties who do comply with the CDC guidelines as their policy, because that really is their only interaction with antibiotics. They do not prescribe them unless they are following guidelines that are currently in place.
Thank you. Looks like Senator Block has a question or comment.
Yeah, this just sounds to me like a good move toward consumer protection, and it sounds like the senator is working with CDA and CMA to reach some agreement. I see it's double referred to health, so I would move the bill along so that it can make its way to health.
Thank you. Any other questions, comments? Seeing no other questions or comments, Senator Hill.
Thank you, Senator
Yes, would you like
Hernandez.
to close?
And I appreciate the motion, and I appreciate the relationship that we've had with the opposition. I mean, the goal here is to find a program, a stewardship program in offices that works, that's not cumbersome, is not a problem, is not overly burdensome to anyone. We just want it to work to make sure that there's some awareness and some stewardship of the use of antibiotics. I respectfully ask for an aye vote. Members, thank you.
Thank you, Mr. Chair. I'm going to not vote at this time. I do sit on health. I've shared some concerns that I had with the author. I'm going to look at some of the amendments that we'll take either in health. Other than that, please call the roll, please.
Motion is due pass as amended to Senate Health. Hill?
Aye.
Aye. Bates? Berryhill? Block? Aye. Block I. Galgiani? Galgiani I. Hernandez? Jackson? Aye. Jackson I. Mendoza? Wykowski? Wykowski I. 5 votes.
Currently has 5. I believe that's enough to get out. We're going to place that bill on call. Item number 6, SB 1192 Hill, Private Post-Secondary Education, California Private Post-Secondary Education Act 2009.
Thank you,
Please proceed.
Mr. Chair. SB 1192 is the first of 5 sunset bills I'm authoring this year. The bill is necessary to make changes to the Private Post-Secondary Education Act in order to ensure continued oversight of private post-secondary institutions that supports quality, innovative programs which are approved in a timely manner, while also making sure a robust government structure prevents predatory practices and promotes student success. SB 1192 ensures that certification and registration necessary for a student to engage in a particular profession are reflected in the BPPE's approval of education programs. The bill will also provide BPPE the authority to give extensions on the timeline for unaccredited degree-granting institutions to become accredited according to certain evidence. SB 1192 establishes an Office of Student Assistance and Relief to serve as a primary point of contact to address the needs of private post-secondary education students, and requires the office to establish and maintain a website to provide information to students about their rights and protections available to them, as well as information about free services available to students provided by local nonprofit community service organizations. The bill also provides recourse through the Student Tuition Recovery Fund to students impacted by the abrupt closure of Corinthian Colleges Incorporated. Through SB 1192, we establish legislative intent to require a private post-secondary education institution that does not maintain a physical presence in this state, but offers distance education to California students, to file a surety bond for the benefit of students suffering economic loss. These schools would also have to register with BPPE. The bill also authorizes Bureau staff to issue a citation with a fine not to exceed $5,000 before leaving an institution when non-minor violations of the Act are detected, an inspection, and increases the penalty for operating an institution without BPPE approval from $50,000 to $100,000. SB 1192 also requires the Director of DCA to appoint an enforcement monitor with a specific concentration on the adequacy of Bureau compliance inspections, handling and processing of student complaints, and timely application of sanctions or discipline imposed on institutions and persons in order to protect the public. These monitors have been extremely effective in ensuring that the legislature has valid information necessary to make any statutory improvements. Enforcement by the Bureau and taking swift action has been a challenge, and I believe that a monitor is an effective way to determine where problems may lie and how we can solve those to ensure students are protected. The focus of any conversation about the Bureau of Private Post-Secondary Education and the Act should be about finding balance. Balance between a thoughtful regulatory structure that allows good schools to thrive while at the same time establishing meaningful opportunities for students. We must continue to ensure that the Californians working to better their lives through education and skills-based training have some confidence in the quality of education and training they receive. It is also important for us to find ways to increase accountability for California students, as well as for the significant amount of public and private resources spent on educational and training endeavors. I respectfully ask for an aye vote, members.
Thank you. Anyone in support, please state your name and position.
Mr. Chairman, Ed Howard on behalf of a broad coalition of consumer, public interest, civil rights, and veterans groups, all in support of this bill. I wanted to highlight a couple of points briefly, please. As the analysis correctly points out when it writes, quote, today a large number of California students are being served by multi-campus, publicly traded institutions with a national presence. What that means is that unlike almost any or certainly unlike any other board or bureau within the Department of Consumer Affairs, and like very, very few state agencies, this bureau is charged with regulating businesses that are multi-billion dollar businesses, and very few state agencies have a comparably challenging duty. The PUC, the Department of Insurance, the Department of Managed Healthcare, and all of them are far better resourced than this Bureau. Compounding that regulatory challenge is the fact that this is among the for-profit education business sector is simply among the most troubled education business sectors in recent history. As the New York Times recently wrote, quote, in recent years, more than 24 companies that run for-profit colleges have been sued or investigated by state prosecutors. To handle this load, 37 state attorneys general have teamed up to form a working group. Together, 152 schools under investigation have obtained $8.1 billion in federal student financial aid in just the last year, end quote. So in addition to having just an enormous challenge, period, that exists nowhere similar in the world of Department of Consumer Affairs and exists in very few instances in state government, you're laying on top of that challenge regulating one of the most troubled industries in the nation. And then on top of that, you're dealing with disproportionately a lot of students who are among the most vulnerable. We're talking about veterans. We're talking about students of color. We're talking about immigrant communities. We're talking about folks from underprivileged backgrounds. In fact, if you look at some of the documents recently released by the Attorney General in her lawsuit against Corinthian, you'll see that the people who were trained to recruit were specifically trained to recruit people with, quote, low self-esteem, quote, disconnected from other parts of their community. So a threefold challenge. First, enormously large companies, unlike anything else in the Department of Consumer Affairs. Second, one of the most troubled industries in recent American history. And third, among the most vulnerable folk in the state who are the targets of some of these folks. Likewise, and unsurprisingly therefore, the problem of for-profit education regulation is disproportionately a California problem. A majority of the students nationwide who were affected by the closure of Corinthian were Californians. Westwood, which recently stopped enrolling new students, has a majority of its students who are in California. Marinello, who was recently cut off from federal student loans because of their allegedly deceptive job placement numbers, 39 of their 56 campuses here in California. So when you think about some of the features of this bill, all of which are very important, when you take a look at creating an Office of Student Protection, when you think about creating an enforcement monitor, which is a common thing, as the senator mentioned, in DCA land to try and make sure it's on the Border Bureau is on target. Those are really needed protections given the unique regulatory scenario involved in this Bureau. I'll also mention that the bill responds to something that the institutions have been asking for, and that is it gives them additional time to try and comply with the accreditation requirement that was enacted recently. So for all of those reasons, the broad coalition of groups I represent respectfully urge your aye vote.
Thank you. Anyone else in support? Opposition?
Hey, Matt, how are you? I'm fine.
Mr. Chairman, members, Matt Back representing CAPS, which is the California Association of Private Post-Secondary Schools. We're, I guess, we're support if amended. I just want to raise one important issue to CAPS. I should point out, by the way, CAPS represents over 200 schools. None of them are publicly traded. None of them are the ones that Mr. Howard just described. These are small to mid-size schools, talking one campus, maybe five. For the larger ones we represent. They've been around for some of them 40, 50 years. Many of them are family owned, and they truly respect the student. They care about the student, and that is what they are in the business, admittedly, of doing, is educating these students. So it is offensive when we hear folks come up here and talk about how bad we are. We're the most troubled sector in the country. That we're the biggest, the most evil. There are truly good actors. I appreciate Senator Hill's comments about trying to find balance for the student and the schools. I think some of the rhetoric around this sector of education, unfortunately, has got to the point where it's just not accurate. It's not truthful. For instance, Westwood, they did not close and leave the students hanging. They did a teach out, which is allowed under the law. So I just want to make sure we sort of level set the rhetoric and the dialogue. We do support the Bureau, the extension in this bill. We look forward to working with Senator Hill on the provisions. We've had some discussions. One very important issue to CAPS is the fee structure. So we have schools that are smaller in size, smaller in students, and have less revenue. They pay sometimes 6 times more than schools 100 times their size because of the way the law is and the way the definitions are of what we call a main or a branch. So we really want to try and find some parity and a different way to do the fees. I know we've had that discussion. It's not contained in the bill. We do also have some concerns on the due process of how the Bureau can come in and the citations and the fines. There's also ways that the Bureau can limit our ability to appeal that in the bill. So just sort of on the due process. The creation of the new Student Assistance Office, which of course sounds like a good thing to do. In our opinion, the STRIF is working. We're actually $3 million over the cap, so there's $28 million in that account. And there are, as far as I know, last time we checked, there's not a backlog. So every application for the STRIF has been filed, and the students have received those monies. So the Bureau is doing that process well. So we don't really understand why we need to create a separate entity, which, by the way, in the bill could be 1 staff for 100. It's all funded by the Bureau, which comes out of our institutional fees. So you would imagine why we might have some concerns with it sort of open-ended, sort of a blank checkbook. And same thing with the enforcement monitor. Again, it's funded by the Bureau, which are institutional fees. There are no guidelines on how big that staff will be. There's no parameters. It certainly raises some concerns. And ironically, the institutions are the one that almost should be, crying for some additional office to help with us. Our applications, at which sometimes are 2 or 3 pages long to get an approved program, take a year for the Bureau to approve. It's obviously frustrating, but we do understand that we need the Bureau. We need a strong Bureau. We need to make sure there are student protections. We need to make sure that we root out the bad actors in this sector to the extent there are any. But we do support the extension. We look forward to working with the chairman. And obviously we know the bill's going to get out today, and we look forward to further discussions.
Thank you. Anyone else in opposition?
Chair, Scott Governor on behalf of University of Phoenix. We also are supportive if amended. We support a strong Bureau. We think there's a lot to work with in the bill. We're still digesting a number of provisions, particularly as it relates to the Student Tuition Recovery Fund. For some of you, University of Phoenix is in the process of being sold, and the new head of the university will be Tony Miller, the Deputy Secretary for the Department of Education. We hope that demonstrates that, there is a strong program here and that students can benefit, and certainly we have been harmed by the bad press of Corinthian and others. One thing I'd like to point out, there are a number of nonprofit schools now which are on the federal heightened cash management list. They are exempt from this bill. The heightened cash management means those institutions are likely to default. They're not covered by this. So if we want to talk about protecting students at institutions that are in trouble, let's look more broadly and not limit this to for-profit. But there are some schools, the federal list is quite easy to read, that are in trouble. So let's broaden this to talk about schools that are at risk, not just for-profit. Thank you.
Anyone else in opposition?
Fred Jones on behalf of the Professional Beauty Federation of California. We are in opposition to the bill. And by the way, I would add not just nonprofits. I'd like to see our public universities held to some of these same standards about placing their graduates in jobs in their industry sectors. However, for purposes of beauty colleges, we have another DCA agency where the BPPE is located, and that's the Barbering and Cosmetology. They're in our schools every year. They inspect our schools every year. They approve the facilities and equipment. They make sure the teachers are properly certified. And of course, they give the licensing exam. They do all of those services of schools without receiving any money from the schools because our schools are licensed with the BPPE. Most of our schools are family-owned. Some are third generation, and they're paying $25,000 a year to be licensed by this agency. There are beauty schools that are bad. In fact, there are beauty schools that are fraudulent, And they're obviously fraudulent. You have to have 1,600 hours to apply for the license exam in cosmetology. There are several Southern California schools that are having a kid sign up today and take the licensing exam next week. How'd they get 1,600 hours? They didn't. They're paying cash and they're selling hours fraudulently. And yet the BPPE is not shut down one of those schools, despite the fact that the State Board of Barbering and Cosmetology has given them evidence of this fraud. The State Board of Barbering and Cosmetology has asked this committee for sole oversight of these schools. Our industry association has asked for 10 years to have sole oversight. This isn't to protect bad schools. Bad schools are hurting our good schools. This isn't about not protecting students. We believe the state board, at least as it relates to beauty colleges, can do a better job than the BPPE. So we would ask, as this bill moves forward, you consider granting state board oversight of these schools so that we can immediately start shutting down the bad ones. Thank you.
Jennifer Tannehill with Aaron Reed and Associates on behalf of American Career College West Coast University. We support extending the sunset on the Bureau. We think it's important that the Bureau be operating strong and efficiently. We have some of the same concerns that were mentioned by CAPS. Our folks are reviewing the bill right now to take a closer look at it with the new amendments to see how much it really impacts them and in what ways. But we look forward to working with the author as the bill moves forward.
Hi, Kathy Van Osten, MVM Strategy Group, representing Bridgepoint Education. Similar to what Jennifer just mentioned, Bridgepoint is reviewing the language. We appreciate staff, the transparency, advising us of what would be in the bill last week. Our conversations with Senator, we do look forward to working with you. We don't have a position at this point in time, but I do want to reiterate that there are some of the fallout that we are seeing in the sector is really a result of some of the regulations that we've seen at the federal sector. So what we're looking for, really, we do want to see BPPE reauthorized. We would like what the state requires to be as consistent as possible with what we see at the federal level, in particular with respect to gainful employment. We have some other comments we've shared with Senator. We'll continue to work with him. So at this point, don't have a position. We know the bill will move forward, and we look forward to working with Senator and his staff
We
this
have a
year.
motion by Senator Block. Any questions, comments from any of the members? Seeing none. Senator Hill, would you like to close?
I would like to respond to some of the concerns, and I just want to make it clear that there are some excellent private post-secondary schools in this state, and they do an outstanding job of educating our students and providing gainful employment for them in the future. Unfortunately, there are those that have not risen to that standard. And that's why we need the BPPE, is to make sure that we oversee those. Mr. Back made some excellent points regarding the fee structure. It is really, unfortunately, unfair. And I know that the BPPE is auditing their fees now, and I look forward to looking at any necessary changes that may stem from that evaluation, because it is not fair today, and it should be. As far as the other issues, we're going to work closely with them because I think they bring a lot to the table and to the discussion. The issue of BPPE overseeing the barbering and cosmetology schools, I'm sensitive to duplicative oversight and regulation, but I'm concerned that really the barbering and cosmetology board, it doesn't really kind of lacks the student protection focus that the BPPE has. I mean, that's the purpose of it. And I think that these students deserve that, and that's what the Bureau can provide. But I look forward to working with Mr. Jones to see if we can find some efficiencies to break down some of that duplicative oversight and make it a lot better and easier to operate in California. So with that, I ask for your aye vote, members. Thank you. And we will continue this as a long process as it goes through the Assembly, and we will bring it back.
Thank you. Please call the roll.
Motion is due pass to Senate Education Committee. Hill?
Aye.
Hill, aye. Bates? Berryhill? Aye. Berryhill, aye. Block? Aye. Block, aye. Galgiani? Aye. Galgiani, aye. Hernandez?
Aye.
Hernandez, aye. Jackson? Aye. Jackson, aye. Mendoza?
Aye.
Mendoza, aye. Wachowski?
Aye.
Wachowski, aye. Got 8-0.
We will open the roll on item number 1.
Let's do consent.
We'll do the consent next after that. We'll do item number 1, and then we'll move to item number 1, SB 1033 by Hill. Current vote is 6-0. Please call the absent members.
Bates, Berryhill, Hernandez. Hernandez, aye. 7-0.
Bill has 7-0. It is out. We'll move now to the consent calendar, which is item number 2 and item number 10, SB 936 and SB 1348. Please call the absent members.
Galgiani,
Consent calendar, items 2 and
Galgiani, aye. Hernandez. Hernandez, aye. Jackson. Jackson, aye. Mendoza. Mendoza, aye. 9-0, that's out.
9-0 on the consent calendar. Thank you. Moving to item number 3, SB 994. Please call the absent members.
Let's see, Bates, Berryhill.
Berryhill, aye.
Berryhill, aye. Hernandez. Mendoza. Mendoza, aye. 7-0, that's out.
7-0, that bill is out as well. Moving to item number 4, SB 1165 by Senator Cannella. Please call the absent members.
Bates, Galgiani. Galgiani, aye. Hernandez. Mendoza. Mendoza, aye. 7-0, that's out.
7-0, that bill is out as well. Moving to item 5, SB 1174, Senator McGuire. Current vote is 4-0. Please call the absent members.
Bates, Berryhill. Berryhill, aye. Galgiani. Galgiani, aye. Jackson. Jackson, aye. Mendoza. Mendoza, aye.
8-0, that bill is out as well. Moving to item number 7, Senator Morrell, SB at 1209. 4-0 is the current vote. Please call the absent members.
Bates, Berryhill. Berryhill, aye. Galgiani. Galgiani, aye. Jackson. Jackson, aye. Mendoza. Mendoza, aye.
8-0, that bill is out. Moving now to Senator Runner, item number 9, SB 1228, current vote 2-1. Please call the absent members.
Bates, Block, Hernandez, Jackson, Mendoza. Mendoza, aye. Wachowski.
Can we get reconsideration on that?
Yes, of course. Without objection, reconsideration on item.
It would come to us.
Okay, moving to item number 11, SB 1400, Senator Wachowski, current vote 4-0. Please call the absent members.
Bates, Berryhill.
No.
Berryhill, no. Galgiani. Jackson. Jackson, aye. Mendoza. Mendoza, aye. 6-1.
6-0.
6-1.
Oh, 6-1, I'm sorry, 6-1, that bill is out. Item number 12, SB 1470, 4-1 is the vote. Please call the absent members.
4-0.
4-0.
Bates, Berryhill.
No.
Berryhill, no. Galgiani. Jackson. Jackson, aye. Mendoza. Mendoza, aye. 6-1.
6-1, that bill is out. Thank you, everyone, for your indulgence today. This hearing is adjourned.